We've been looking at the debate around drug law reform for years now, and an important part of that is critiquing the war on drugs and the failure of the war on drugs, the fact that it's a policy that is supposed to protect public health and it's supposed to protect communities and promote health and safety and well-being generally, but seems to, or very clearly has over the last 4 or 5 decades that it's been in place, effectively done the exact opposite. Things seem to have got worse. It hasn't reduced drug availability, it hasn't reduced drug use, it hasn't reduced drug-related harms. Clearly all of those have risen fairly consistently, and it's created all these other harms associated with the violent illegal trade controlled by gangsters, which causes problems from the streets of London all the way to Afghanistan and the jungles of Colombia and so on. So there is this very powerful critique of the war on drugs. But beyond that critique, we have to say, okay, what could we do that would be better? What would protect the public, or what would deliver better outcomes? So part of our work is the critique, and part of it is exploring alternative approaches that might deliver better outcomes. And we've been focusing more on that latter side of things in the last couple of years. And one of the projects that we've been working on was called After the War on Drugs, Blueprint for Regulation, which eventually matured into a book, which was published in 2009, is available online freely as a PDF. That really looks at what the models, what a post-prohibition, what a post-drug war world would look like and how it would function. How could we legally regulate some of these potentially very risky substances in ways that would better protect public health and hopefully address some of the problems associated with the illegal trade. So that's what we've been looking at.